Well, finally back in Perth, and I've had so many people messaging to ask me about treatment results. Given that this week is 1 month since I stopped treatment and 2 weeks since I got home, I thought this would be probably a good time to do a little bit of an update video. I will stress that these are partial results because obviously, as I've said previously, the results are likely to improve as the next 6 months goes on. The biggest thing I've noticed is that in the past 3 months, I have not deteriorated at all. And it's the first time in, I reckon, about 15 years that has not happened. So I'm really happy with treatment results just for that purpose alone. As I've said in previous videos, for me, this was never about a cure. A lot of the damage that was done was irreversible prior to me going to Cyprus, but I have noticed lots of little improvements. I'm still very much a person living with disability. I'm still not anywhere near at a normal function, but we knew that the treatment was never going to achieve that because I am too far down the line of severity. But significant impacts on quality of life. And I'm going to take you through those. I do apologize. I am using notes. My Lyme brain is still very much there for short-term memory. And I know a lot of the Lyme patients are curious as to details of what is better and what isn't. So I don't want to miss anything for them. So we'll start off with brain. I've had brain fog and issues with my brain for a very long time now. In terms of concentration is my biggest one. So when I use a computer, I can use it for a small amount of time. I haven't been able to read a book for around 3 years now because with the brain fog, I can read a few lines and I forget what I've read and can't process the information that I've got. It's made doing things like judging Telstra Best of Business Awards and judging Westpac Scholars extremely hard. Luckily, they do use video most of the time for their judging, but the written sections have been extremely hard for me. It's taken me hours to go through those applications. The biggest thing I've noticed since treatment, I can now read again, which is something I have always loved doing. I cannot read anywhere near at the capacity what I could before. I can now read almost a chapter of a book, which for me is a huge achievement, and that's in one sitting. So a chapter at a time, and I've managed to finish my first 2 books in probably 3 or 4 years. So that is a really big change. I can also comprehend things better. My day-to-day, my brain fog has decreased. It's still there, but has decreased. The other thing with my brain is balance, because that's also controlled there, but there's been no change as yet to balance. I'm still very much a full risk, very much still off balance. Next up, in terms of consciousness, I go into what's called pre-syncope and syncope, and I've talked about this in videos before. Pre-syncope is the feeling you get just before you pass out. Syncope is when you actually do pass out. That still happens, but it's not as frequent. The biggest change for me, most nights I can shower fully. Before, I was half showering, getting the pre-syncope, going to lay down, then finishing the other half of my shower. Now I can shower pretty much all in one hit. Some nights I do still have bad nights in the shower and do still get the pre-syncope, but it's normally only when I've overdone it or done something I shouldn't have done during the day. That is so much better than every single night like it was before. Skin, I've noticed a huge difference in my skin. It is much, much better now. Had lots of issues with that before. Digestive system, I also said prior to going to Cyprus, if we can halt the issues with my digestive system, that would be worth the trip. that has happened. When I first arrived in Cyprus, my intestines showed paralysis on the testing that they did. I was also showing heavy symptoms of it. Gastroparesis and POTS kind of goes hand in hand. I was warned that digestive system would be the next thing to deteriorate. As of probably week 4 of treatment, my digestive system is working normally now. We're actually at the point where my stomach has been rigid for so long. I forgot until a couple of weeks ago it wasn't meant to be like that. So huge difference with digestive system, and it's made a massive change in me for day to day, because digestive system is quite full on and intense when you have issues with that on a day-to-day basis. So very happy with the results there. Bladder, I haven't noticed a difference in bladder at all as yet. I am quite heavily medicated for my bladder. I go in for surgery twice a year for Botox into my bladder to control that. So I have Botox done when I feel I need another round. It will be interesting to see over time if the time between surgeries increases as we go. But as yet, no changes with bladder at this point. Fatigue. Any Lyme patient will know that fatigue is an absolute nightmare. I used to nap 5 to 6 times a day. Now, I'm still not at the point of a normal functioning person with fatigue. I still nap, but only 2 to 3 times a day. So that makes a big difference right there. I can also do a lot more now than what I could do before. And I find myself bouncing back quicker. So if I've had a big day before, I would have had to rest 3 days before and 3 days after. Now I sometimes can get away with just 1 or 2 days rest either side. So I know that sounds like a tiny thing, but to someone who can't do it, it's absolutely massive. So also noticing that I can sit up longer and that I can stand longer. So that's fantastic. Again, nowhere near what a normal person would be able to do, but it's better than it was. Legs, well, legs have been one of my number one issues for years. They've been a mess for years and they're still a mess. A lot of the damage to those was irreversible and has been for a long time. But I have noticed some little changes in them, and I've had my standard email to go into UWA for the podiatry class because they use my legs as an example of what can go wrong with them. And I do that every year. It'd be interesting to see what they say when I go in this year. But I've noticed that my legs are a bit stronger. We've noticed my posture is much better, particularly when using the walker. I'm not needing to lean on it quite as much as I was before. And just little things. So at the airport in Dubai, the plane had steps leading up to it. I had wheelchair assistance right throughout, but I still had to climb the steps up to the plane. I didn't think I'd be able to do it. I definitely wouldn't have been able to do it 3 months ago, but managed. It was a struggle. I needed help. I needed someone carrying the bag so I could steady myself, and it took forever, but eventually I got there, and I wouldn't have been able to do that before. So again, nowhere near what a normal person would be able to do, but better than it was. The numbness in my legs is also better as well. Pain-wise, the abdominal pain from gastrointestinal symptoms is totally gone now because we seem to have fixed that issue, at least for the time being. I still have huge leg pain, but it's better controlled with meds now. And there are some nights I don't wake up in pain anymore. So the pain used to wake me up in the middle of the night 2 or 3 times. I'd have to get up, take painkillers and everything like that. I find I'm sleeping through the night much better. I still have really bad nights. I still have nights when I'm in a lot of pain, and I still have basic pain, but I feel like the intensity of that has gone down. Sinuses, much clearer now than they were before. And when I first got diagnosed, I was having blood noses 5-6 times a day. That stopped for a while, but had started again not long before I left for treatment. and that's totally gone again now. So no more blood noses at the moment. Lymphatic system, lymph nodes are no longer swollen. So that's a positive. And swelling in general throughout my body is much better, particularly in my arms and legs. I used to puff up like crazy with just a little bit of fluid, a little bit of heat, a little bit of stress on my heart. Now that is much better than it was. It still happens, but not as bad. Cardiac wise, other than the syncope and pre-syncope, which is affected by heart rate, I haven't really noticed a massive difference in that. I'm still reaching ridiculous heart rates, going from sitting to standing. I can hit 160 heart rate without even trying, and heart rate and blood pressure are still very erratic. So not a lot of change there at this point in time, and same with temperature regulation. I haven't really noticed a difference in that yet either. We have now set up a rehab room in my house. There's a few more bits of equipment coming in this week, and that's so I can keep up the rehab work, all the exercises I've been given and everything like that. There's no point going and having the treatment I did and then coming back and not continuing to work to maintain the results that we've got. So that will be happening. I have a doctor's appointment in a couple of weeks. I'll get my blood form, and it will be very interesting to see what my blood test results are, because I tend to collect abnormal stars on those. It's very rare for me to have a blood test that has under 10 to 15 abnormal markers on it. So I'm really curious to see what that first blood test comes back at. So just day by day still at the moment. I have good days, I have bad days. In my opinion, it was definitely worth going because, as I said, those things that sound like little changes, like being able to shower, sounds like a tiny thing, but to someone who can't do it, it is the most biggest lifestyle change, and improves your quality of life so much. So that's the results at this point in time. I will continue to update because they're likely to change over the next 6 or so months. Also, for those who have asked about my Centrelink, yes, it has been reinstated, and you can go back and watch the video if you're not sure what happened there, but they basically cut me off while I was away because they said that my trip wasn't necessary medical treatment. But they told me it would be automatically reinstated when I entered the country, and it wasn't. It's taken me a while of fighting and phone calls and advocating for myself to have that reinstated. So it has happened, but it wasn't as simple as what they said it was. So that's the update at this point. Again, if anyone has any questions, feel free to let me know, and I'll update again when I have more results to share.